was diagnosed within a day. And they actually sent us to the NICU down the hall for observation. The whole experience of birth, delivery, diagnosis, and going home happened within 3 days. And we spent 1 day in the NICU. They did nothing but check his vitals. We stood by his side the whole time. We left the NICU within a couple of weeks. We got a $50,000 bill. This is all while we had one of the best insurance plans you could find. And we said, what is this? And like, oh, well, the NICU is an out-of-network provider. Caring for severe hemophilia is a very comprehensive endeavor. Not only does he require the medication that replaces what's missing in his blood, but occasionally he may need to go have physical therapy. He needs to watch how he needs to exercise, make sure his joints are healthy and strong. And it takes a whole team of people, not just us as parents, but doctors and nurses and social workers to help us out. The hard part that a lot of people see is that we have to help his bleeding condition by poking him with a needle and giving him his medication intravenously. And it's tough. It's a lot of people are scared of needles. It's something we've learned to do at home rather than having to take him into the hospital or to the doctor every day. We've always had insurance. At the time, we had one of the best insurance plans you could find. Well, then my son was born, and once he started racking up high dollar claims, the next year my employer was forced to reduce their benefits, put everybody into a high deductible plan, and add a cap on the plan. And the cap was designed to weed out my son within a year. And that kind of set the sands of the hourglass in motion for us. We knew we had to get our story out there. But we also knew the consequences of telling our story meant that my wife and I would potentially be unemployable, because employers would now be able to Google our names and see that we would cost their company $1 million or more a year. But we put our story out there. We made connections. Suddenly I get a call one August night from the White House, and they said, hey, the president's going to be in Grand Junction tomorrow, and we would like you to tell your story and introduce the president. So. Putting our story out, we were able to do amazing things. And everything from meeting random people with their own struggles and not knowing how to deal with it and giving them advice, and then coming back and saying, you've really helped me out. To me, that's one of the greatest things. Now, we've been able to meet the president. I've taken my son to the White House. I got to testify before Congress in 2009, which was a phenomenal experience. But being able to reach out and know that we're helping people, it's been great. Our story continues. We're dealing with the illness on a daily basis, and that's what life is like for people dealing with chronic illness. The Affordable Care Act and even some of the legislation we've passed in the state have been great, have helped us out, have helped other families out. The reality is that the struggle continues. There's all sorts of other things we need to continue to do, both federally and at a state level. I've been able to continue to do some of these things. I'm looking forward to helping other people tell their stories and get out there and help us continue this progress we're making.